Hi everyone, good afternoon. I'm quite happy to see that there are a few more people left here, considering that we're at this time of the afternoon. And Cameron and Marion, you probably heard this several times today, but I'll still say it. Thank you for having me here. I'm so excited to be here. So, like Cameron said, my name is Pamela Bongkiyung, and I work as a Communications and Research Uptake Officer for a program at the Liverpool School of Tropical Medicine called Countdown. So I'll just literally walk you through what we do on this program. So Countdown is a 5-year implementational project that is funded by the Red Division of DFID, and it was created in March of 2014. So we're literally in our 4th year. The program would decidedly come to an end in October of next year. So we are very much focused on NTDs, and we work in 4 countries, Cameroon, Ghana, Liberia, and Nigeria. And what this program seeks to respond to is how we can cost effectively scale up NTD actions or control programs within the health systems, and we're looking to upscale in Nigeria. So we've had a few interventions going on in the program to try and measure all of this. So moving on, so our program is very multidisciplinary, which means we work with people from various disciplines. As you can see, we have 5 of them. So we've got social scientists. We've already heard about Annie Wilkinson talking about giving context this morning, and very much talking about anthropologists, and that's very much what social scientists do. So we also have health economics for the cost effectiveness component. Health economics is actually one of those research areas that is gaining a lot of traction because people want to know whether or not what they're doing is giving value for money. So, and at the heart of the Countdown project, we are trying to produce evidence that responds to issues such as marginalization, disability, vulnerability, access, and equity, which are things that have been echoed throughout today. So I'm going to now slightly take you back to basics on what science communications is all about, because we've heard people talk about science communication, but let's give it a bit of background. But before I do that, just to echo a bit about what I do in Countdown. So we work with a group of researchers, we produce research, we have peer-reviewed publications, and that is done with the data that we collect from the field. But then how do you move from that research evidence to actually creating impact? So there is this huge gap between evidence and impact. What actually works within the health systems of those countries, what practices should we be implementing from the evidence that we have from this research, and how can we do so sustainably? So that's where research uptake comes in, and that's what my job is all about. But before that, so this is what we'll be looking at in a nutshell in the session. We'll just give science communication a bit of a historical context and why we communicate science and some of the tools that we can actually use to bridge that evidence impact gap that I've just mentioned, and just a bit of an outlook on the evolving technologies that we could actually implement. We've already seen Lisa doing that. If some of you went to Jamie's session, you probably have experienced some of those different technologies that is bringing along the digital transformation that is changing science communication. So what is science communication? People define it differently. It could be how scientists communicate to the public, the interaction between different groups discussing science, like what we're doing here right now. This is actually what some people would think science communication is all about. Some people view it as more of how the media represents science and the ways in which people use scientific knowledge in their own lives. So moving on to that historical context, science communication is not a very new thing. We can see that Michael Faraday, who we all know is a great scientist, pioneered what he called his Christmas lectures, and he had over 30 of them. Until date, we still have a science segment show that is done with the BBC, I think. And Michael Faraday, having done a lot of experiments in the lab, he decided that, okay, there is just a small niche of people who know about what is happening with what we do in the lab, but it's important for the people out there to become more involved in the things that we do in the lab. So he began his Christmas lectures. And this is what he said about them, that if a flame should be lighted at the commencement, it should be kept alive with unremitting splendor to the very end, which means science communication has to be a continuous thing. So why do we communicate, really? In essence, what we've been doing today is about informing ourselves, educating ourselves, and empowering ourselves, because with the knowledge we get to understand science a bit more. Some people would look at communicating science as a way to share knowledge that can benefit all of us. Others view it from a very economic imperative. Say if you're living in a very developed country where science is highly advanced, you're thinking, okay, my skills need to match up to the needs of the growing market. We're hearing about artificial intelligence now. If you don't want your job to be taken over by robots, you have to think of a way that you're going to measure up and survive this new world that is happening. So some people would look at it as, aligning your skills with the changing technology, and for others, it's about a cultural heritage. Innovation is in the blood. It's part of who we are. So science as a cultural imperative, and also it could be very democratic, because a very informed population, it's a powerful one, which means they're very informed about what is happening, and they can push their policymakers to make the right decisions for them and for the country. So science communication is not just about peer-reviewed articles and just getting things out of the lab out there, but it's also how people understand the things that happen within that science milieu and how they interpret it and bring it to life. So moving on to those tools, the tips and tricks to dismantle big scientific concepts. Social media is one of those things that have happened to us, and it's changed a lot of things. So we see that people now mostly engage with social science on social media platforms, mostly Twitter, Facebook, YouTube, but it might be that some people have like their WhatsApp group that they use to communicate things. LinkedIn is also one of those places that I've started seeing blogs popping up with people talking about what they're doing. So very professional milieu. But let's have a look at what the countdown program, how it uses the social media platform. So we have this social media ecosystem, and it begins with our blogging site, which is the WordPress site at the very top. So because there are all these different social media, it's very difficult. It's very easy to get lost in all of them, because you're thinking, which one should I focus on? And you can't spread yourself too thin, because once you do that, you could actually lose the message completely. So the importance is to focus on one and use it and do it very well. But then you don't want to miss out in the other areas. So how do you do that? So what we've tried to do is interconnect all our social media platforms, and the way we've done that is in the WordPress site, we always have blogs posted up. So the blogs automatically post to Twitter, and we have a Twitter page on the website, and on the Facebook as well. So everything that goes from the website to the WordPress always comes via Twitter, and then Twitter, we've linked it to our Facebook page. And for example, the YouTube is where we make use of the videos that we've had in the field, so very good interviews of people talking about the research that they've undertaken. So we've had Lisa Russell here talking about the use of video and how to impact global health. So we're seeing that video is becoming more and more powerful. So in essence, what we do with the social media ecosystem is creating real-time connections across our partners. So because we work with partners across multiple countries, how do we know what they're doing? So through their Twitter feed or the websites, we're able to be updated on what is happening within those countries. We understand that NTDs are very complex issues to communicate and understand. So I'll start off by showing you a video done by the Bill and Melinda Gates Foundation, just to give you a bit of a teaser on on how we can really simplify NTDs.
But it should be easy to see why we care about them. They kill over 100,000 people every year and cause tremendous suffering for millions more. but we can feed them thanks to the efforts of many donors, pharmaceutical companies, and health workers across the world. Together we can beat these diseases and build better lives for millions of families.
From Bongkiyung audiences.
Right, we got there eventually. So this video was posted on Twitter by the Gates Foundation, obviously, and we can tell that, you know, though it's been very simplified and you see people struggling to actually pronounce the names of all these diseases, it's much more, it's a very serious issue than that. So sometimes another way to try and dismantle a big scientific concept is bringing it down to the very basic, like they've done with this video. So it's kind of like an introduction to what NTDs are all about. So for example, Bill Gates probably did a better job of saying Drac and Co. I can't say it. But yeah, so it just gives you an example of how we can get people to understand a bit more about some of these things, because it gets them thinking and starts conversation about what are all these diseases about. And we'll soon find out that there's one of us here is more an ignoramus about this disease, and that shouldn't really be that person, but let's carry on. So sometimes what you can do is piggyback on what other people are doing. We didn't do this video, but it was very informative and it touched very much on some of the things that Countdown is working on. And so we made this comment about the video and hoping that 2018 would be a pivotal year to intensify efforts to beat NTDs. And I suppose part of that is what we're doing here. And somebody asked a question earlier today about whether or not we're going to meet the 2020 targets. And I had to chuckle a little, but you know, there's a long road ahead and we're working it. So we've gone through the first two objectives of this session, so let's delve into the real deal. So an example of what I was going to point out that you could use to actually simplify your messages is using a GIF, animated picture interactions. I'm seeing more and more people using this on social media, but it wasn't, people actually use GIFs as memes, so for things like comedy, but now you can see that people are actually using it for social media campaign. So this is a universal health coverage campaign that we did in November of last year. So we did it with a group of other NTD organizations and other organizations that work in global health. And so it was just talking about the 5th anniversary of the universal health coverage, and you can see that it packs quite a punch. You see everything being mentioned here. There's primary healthcare, you're seeing gender equity here, national security, fair economy, so everything. So these are some of the ways that you could actually use to make things very simple for the audience to understand by just highlighting some of the things that actually make up what you'd call universal health coverage, because someone would say, what does that entail? But this gives you kind of a picture. So this is another GIF, but actually this one is not an interactive one, unfortunately, but it was just, it showed the journey of community health workers and how they move, how they try to reach very remote areas, because their job is not a very easy one. They stand at the forefront of health systems and actually controlling NTDs, especially when it comes to mass drug administration. Those areas that are hard to reach, that is what community health workers have to do. So this GIF is literally taking us through this village and the journey of community health workers. So what the GIFs do in essence, do people say GIFs? I say GIFs. So you can see that it's storytelling in its most basic form, and it's also visually appealing, which means that it can speak to anybody really. If you're a researcher, if you're a non-researcher, you could understand the basics of what this is trying to convey. So the file sizes as well, that can be quite an impediment. Say for example, if you come from a southernmost country where internet connection is an issue, if you have a GIF, then it's easier for you to share this as opposed to uploading a video that might be heavier in size and you probably be stuck for days trying to upload just one video. So it is convenient and also very simple to use. So some of the ways, because people have talked about communities, engaging the community, we saw Mentor here talking about, their focus being very much about getting the communities engaged, training the community. So another way that Countdown has tried to get the communities involved is using trusted voices within the communities. For example, meet Dr. Evelyn Kandakai. So she's a former Minister of Education in Liberia, and now she's the NTD ambassador. So what Countdown has tried to do in the countries that we work with, we've tried to establish NTD ambassadorship. So these are people who advocate for NTD programs and push for it at the community levels, at the national level, regional level, and possibly international level. Why not? So on the 7th of February this year, there was a mobility event that was held in Harper in Maryland, not Maryland, USA, Maryland in Liberia. And so it brought together for the first time, we had people who were suffering from leprosy or lymphedema who came out in the public. You know that there's a lot of stigma attached to these diseases, but this was a platform, an environment that they could actually come and the community could understand about their illnesses and what they're going through, and to understand that, what they had wasn't maybe not due to witchcraft, but that there were real conditions, and try to understand what causes them. Because sometimes we ignore how ignorant the community is about the diseases that exist within their environment. I'm not saying that they might not understand some of the context, but it's just that other narratives come and distort that, so it can be quite dangerous. So this one was a very important one, because you see community health worker here who's leading the workshop and trying to tell people about their work. So we've heard about lack of trust. In the first panel session, there was a lot of things, people saying people do not trust. So that lack of trust. So these are some of the things, elements that you use to establish that trust. So it's all very well to go to a community, get your data, write your paper, perhaps have it in the Lancet, but what use is it if the end users who are found in the community do not benefit from that knowledge? What use is it if we do not educate and inform these people to adopt different behavioral approaches to stop themselves getting reinfected? Because what could happen is we would write papers, we would change policy, but at the end of the day, you will still come back to reinfection occurring, and that same vicious cycle still happening. So these are some of the tools that we use at the community level, trying to focus on the end users at the community level, because these are the first port of call when the sufferers, or when we talk about NTDs and infection, and trying to get people out of poverty and changing all of that. So here's another example from Ghana. So we've got Dr. Joyce Arie, who is the Ghana's NTD ambassador. She's also a former minister. She's held a lot of ministerial portfolio. So if you've worked with MDAs, you know that there's been cases of severe adverse events. And actually, I was attending a STEMPER event. STEMPER is like PR and comms people working in science and comms. And so we had a training day, and we had people from NICE UK who came, and they said that actually they did a survey, and it emerged that most people are 2/3 more than likely to believe what their family or their friends tell them, as opposed to scientific facts. So that tells you a lot, which is why if somebody has an adverse, severe adverse event, they're most likely, if somebody from the community or somebody from their family tells them, oh, this drug is bad, don't take it, they will not take it. So it doesn't matter how well the drug would work for them, but they will not take it. So we've seen some of that in terms of the MMR jab, and how that caused a lot of furor around Europe, and even in the Americas, where people are adverse to taking in, getting their kids to get their jabs and things like that. So these are some of the ways that we use NTD ambassadors to try and to bring a bit more trust into the whole process, inform the schools more, and maybe have conferences around this and try to explain the process, and maybe highlight some of the issues that could lead to severe adverse events, as in if you've not eaten, that's what could cause, you having a severe a severe adverse event if, you take the drug on an empty stomach. So just dotting the I's and crossing the T's. And so another way we've also done this is the training of journalists. Some of you would have looked at the history handbook, Making History. So we have Professor Louis Albert Tremchenter, and he is the national coordinator for schistosomiasis and soil-transmitted helminths in Cameroon. He's also the Liverpool School of Tropical Medicine NTD ambassador, and he is also the director of the Countdown program. And he has an organization called the Center for Schistosomiasis and Parasitology based in Yaoundé, Cameroon. So what he decided to do was to train journalists from the regional level, the community level, and the national level, and across the different media, from radio, print, and television. so that they could see firsthand the experiences that people actually go through when they're trying to reach these hard-to-reach communities. So here we see the journalists having their briefing, and in the second picture you can look at how bad the roads are, and that's with a good car. So just imagine somebody who has to walk on foot. It's usually, most of these MDAs seem to happen in the rainy season when the roads are very terrible and the roads are unpliable by cars. And in the third one, they're forced to get out of the car and walk. So the journalists can see firsthand, the experiences of covering NTDs, understanding the things that happen within those communities, and so it gives them, so they have embedded knowledge to report better about these issues. It would be a shame, because the question people never ask themselves is, how can you report on something that you don't understand? People just take it for granted that, because somebody has, they have a science degree and things like that, they'll probably understand about NTDs, but there are different specializations. So you could be a science journalist, but that doesn't necessarily mean that you understand the context of the things, especially people within the country. I'm going to use myself as an example. I grew up in Cameroon, and until about 17 months ago when I started working at Liverpool School of Tropical Medicine, I didn't know what NTDs were. So I was really shocked. And when I read the statistics and I see these diseases are prevalent, and I'm just thinking, where? I've never heard of it, I've never seen it. And for the first time in my life, I came in close contact with onchocerciasis. I found out about leopard skin. And these are things that I wasn't aware of. So that tells you just how the disconnect can be within endemicity within the community and the knowledge that people have within that community. So how can you make change if you don't understand that there is these issues to change? So we can see that before getting into the communities, the first point of call is always to engage with the elders of that community. We saw the mentor initiative talking about in countries that are very Muslim, how they have to go through the women. So here, the gatekeepers of the community are the elders. So you can see Professor Lee Tremchented there, sat with the elders. And getting to these locations also, you have to go through a boat to go to this tiny island. It's called Baron-Bikoto in the southwest region of Cameroon. And so there they sat in the chief's palace, just highlighting some of what they're here to do. And so at the end of this training, one of the journalists wrote this article for one of the widely circulated newspapers in Cameroon called Cameroon Tribune. And it was also featured on this news portal. It's called All African Portal, where all news from Africa comes across. It's congregated in one place. So you can see that this was very life-changing for this journalist. So they now have this knowledge that they can then use to communicate about NTDs more effectively. And this is something that possibly wouldn't have happened. They've written about it just like an abstract, but now that you've actually experienced it, you have the practical experience of having, seen this. It gives a different perspective. You write differently about things that you experience. And at the start of this conference, Imran said something that with science research, there's a tendency to talk about facts, to talk about statistics, but we forget the emotional. People try to relate to the information. So how do you do that? When you've been embedded in that situation, it changes how you see things. Lisa's here trying to change how stories are told with a film instead of the usual stories that we see. So these are just a few examples. By any chance, how many of you here blog? Come on. Okay, so quite a few hands are going up. So blogging is one of those things that's actually coming up and is a good way to try to synthesize information and get people engaged before, if people can't understand, or digest information from scientific papers. Sometimes I find that when I'm reading some of the papers, they can be quite technical, so I struggle. So one of the things that does help is reading a blog that gives a more simplistic summary of what the paper's talking about. So that goes with our first point, and also the fact that blogs do have a lot of impact. We've had an example of where somebody wrote a blog about their experience of working in Sierra Leone, especially during the Ebola crisis and building resilience in that kind of setting, and it got them invited as a keynote speaker to one of the conferences because it was very emotive, it was very relatable. So people said, I very much understand this now a lot better, so can you come and talk about this at this conference? And so another way we've taken to trying to get more scientists involved, because I know somebody mentioned something that comms people need to handle communications and let scientists deal with science, but it's no longer enough to just be a scientist. You need to communicate your science, you need to communicate what you're doing, because people like to put a face to the work. Reason why we all see Stephen Hawking, well, may his soul rest in peace, would also give appearances, and talk about his work. People have read his book, but the fact that he comes and shows himself and talks about it, it gives it that more impetus, it gives it that more of an umph. So we've been training the students who are doing a diploma in tropical medicine and hygiene students on how to blog at ISTM. So just helping them to understand they can start talking about some of the things that they're doing right now, and maybe discussing ideas and start getting engagement in that way. So in a nutshell, engaging with this ecosystem. So recently we had an annual partners meeting, as you can see there, last week, and we had visual minutes there who kind of summarized everything that we discussed in those visual minutes. And so Alex has kind of been doing that for us here today. Beautiful, beautiful visuals. So these are some of the ways that you could use to make messages more relatable. And so when you listen to the presentation and you had a look at these images, it made it so much simpler. You could just easily connect with the key issues without having to go through so much. So, Alex has been doing that for us, and those are some of the ways that you could actually use to dismantle some of those concepts. So you can see this one here is talking about female genital schistosomiasis, and one of the lady who is giving the presentation, she's a social science lead from Ghana, Professor Margaret Japong. She's actually giving an inaugural lecture tomorrow. She talked about how some young women would come to the hospital and they'll be presenting with FGS symptoms, but they were misdiagnosed as having STDs. Because of that, they were stigmatized, and obviously they didn't get the right sort of treatment. So the importance of trying to communicate and actually sensitize medical health practitioners to some of these symptoms that could be misdiagnosed for other diseases or illnesses that aren't actually. So keeping an eye out. So those are some of the things that we've seen. And then we also had this paper that was written by one of our researchers, Corrado Minetti, in collaboration with others as well. Professor Russell Stoddard has spoken here on so many occasions. Some of you might know him. And so he was literally talking about the need to, make diagnostics a lot more accessible, and using what we have to optimize the data that we've got, or the samples that we've got, that sort of thing. So he also wrote a blog about this to go with his paper, because the paper was highly technical with a lot of statistics. So this is some of the ways that we try to give research papers context and try to make them more relatable. And so we have this PhD student for Professor Russell Stoddard as well. He's the director of the program. Sorry if I keep referring to him. And this is Rosie Paulo. She's a PhD student based in Angola. And so she attended a workshop about preparing to go to the field, tips in field epidemiology. And this is an excerpt of what she wrote, because people have an idea of what it means to prepare to go to the field, but do you really? And so for the first time she came in, she connected or understood what goes into it, and that is not something you can do off the cuff. So here she discusses her experiences, so you can see that it's a very participatory kind of one, and very inclusive in that this is a PhD student who is yet to start her career, and she's already understanding the importance of communicating some of the challenges that people might encounter. So it's all very well to talk about synthesizing information and trying to make it simpler for everybody to understand, but we also need to balance our act. We don't want to dilute the information so much so that it loses its essence, it becomes too water-washed. So what we do is we have a block content review process that we use in-house to make sure that even though we've simplified or synthesized information, it's still very, very much reflective of the research work. So we speak to the researchers and make sure that the way we've actually represented the quantitative data or the imagery we've used is still very appropriate and could resonate with our audience at the same time. So another way that you could try and balance your act is using your organization's press office. You sometimes find that there's a huge disconnect between people in their press organizations, so they just go off and do things in silos, and whereas a press organization is there, press office is there to also help you with targeting your various audiences if you're reaching out to that. And another way is you can reach out to people doing similar things to yourself on social media. They've done so successfully. And talk to people within your institution as well. Participate in events and festivals as this one's. I came in here, I could say that I came in here empty, and now my glass is very full. So I've learned so much from all the presentations I've begun this morning and the challenges that people deal with and the solutions that they try to deploy to resolve those issues. And use the pictures to draw your audience into your message. So also as part of that STEMPER training, we had journalists who came from national newspapers, and people were very interested to find out, because nowadays you find out if you work for research organizations, you have to pitch stories because you want people to be aware of the research that your organization is doing. And so the question to the journalists was, what do you want to see? And so the journalists were very much of the opinion that it's no longer enough to just send a press release with just 1 or 2 pictures. We need a lot more pictures that are visually appealing. And not just pictures, but we also want video, because it's not about print anymore, it's also online. So if you notice, most newspapers now, when you go to their online platform, they usually have a video accompanying the story, so that if you don't actually read the story, you can watch the video. The Economist does that really well with on LinkedIn, where they do like a summary of the stories themselves. So somebody mentioned, I'm not sure who mentioned today, about nobody uses words anymore. It's all about subtitles and the visuals. I quite remember who said that. So this is an example of how we use Press Office. So I work for a program called Countdown, but Countdown is better with LSTM. So LSTM also has like the general organization comms office. So working with them, because we do have a website as well, we were about to launch our program in Nigeria in March of last year. So I got them to send out this press release. And at the time of doing this, because there should be more views than this, there were 154 views before the event actually started. So just letting people know that we're arriving in Nigeria, and letting all the partners very active in that space to be aware that we're ready for business to come work with us. So as you can see, what has worked for us in essence is using trusted voices within communities, getting them to get more people engaged and creating more conversations. And you see that we've also developed capacity of the media to report on the issues that affect their communities. And so we also engage with a multitude of stakeholders across across various social media, and we've participated in advocacy meetings, events, conferences. And let's not forget that as much as we can engage on social media, nothing actually beats face to face. So that personal touch is very essential. And we also regularly reflect on how we communicate and think of ways to improve, because there's no one right way to do this thing. And things are constantly changing, and we need to change with it. So a lot of reflection on improvements, monitoring, evaluation, that kind of thing. So one important thing that we need to remember is that in communicating, we shouldn't just try to be informative in how we communicate and interact, but we should push for a more transformative outcome. When Anna Wilkinson was talking this morning about how the Western media was reporting about the Ebola outbreak and the kind of words that were used, ignorance, those kinds of negative connotations, she also gave a set of questions that people asked. And they weren't very abstract. It would be something that every normal person would ask in that situation. So it reminded me of a TED Talk, which, by the way, I just found out Lisa has actually given a TED Talk, so we're in the presence of greatness, people. So it reminded me of a TED Talk that one of my favorite authors, Chimamanda Ngozi Adichie, gave on the danger of a single story. And at the end of it, she said something about words. She said words can be used to dispossess and malign, and words can also be used to restore. So as a comms person, I hope that the work we do doesn't stops us or doesn't give room for us to have to restore anything that has been dispossessed or maligned. So one thing I want us to think about as we leave here today is what are you going to do when you return to your organizations? Will some of these tips and tricks help you? Would you think of different ways of communicating your messages? Who would you focus on? Thank you very much.